Hi, my name is Dan Hamilton from White Horse Training. Today I'm going to be demonstrating adult resuscitation. So, danger, response, airway breathing, DRAB, our primary survey, needs to be in your head at all times. So we're starting right at the very top with the D, and that's for danger. Make sure the area is safe before you even approach your patient. You do not want to put yourself in any danger. If there is no signs of that sort of danger, we need to be looking for catastrophic bleeding as well. Any limbs missing, blood spraying out or pools of blood, we need to deal with that bleeding right away. If there's no signs of catastrophic bleeding either, we move right on to checking for that response. So we need to be talking to our patient and do the old shout and shake. Hello mate, can you hear me? Can you hear me down there, mate? I approach my patient, get down beside him, give him a good firm push on the shoulders, talk in both ears. Hello mate, can you hear me? Can you hear me, buddy? Just in case hearing impairment. And if there's no signs of response whatsoever, we need to be getting on to shouting for help. Shout as loud as you can, scream, hopefully someone may hear you. They might come and give you a little bit of a hand and get on the phone for you. Next job for you is you're going to be opening and checking that airway. So what we need to do is look in that mouth, have a good little look in there and make sure there's no signs of vomit, blood or any other objects in there. If there is something in there, we need to do the recovery position, get them over, drain as much of it out as you can, put them back on their back, and then we can open that airway. So what we're going to do is the chin lift, head tilt. Good support on that chin, trying to pull that chin forward, supporting that head, and you only go as far back as you need to. Once that is open, we can get our ear down, look across the chest, and what we're doing is looking, listening, and feeling for 10 seconds, no more. 1 Mississippi. 2 Mississippi, 3 Mississippi, 4 Mississippi, 5 Mississippi. As you can see, it is a very long time. Now, if you are having a bit of an issue seeing the breathing, because they might have a big coat on, just undo the coat a little bit, just so we can see that chest movement. Now, once you've done your 10 seconds, and there's no signs at all of normal breathing, and what we mean by normal breathing is normal breath taking. So if they're making loud sounds, gasping, snoring sort of sounds, that is not considered normal. It could be agonal breathing. That means we need to start CPR. And if there is no signs of breathing whatsoever, then again, we need to be thinking about CPR. So what we need to do for an adult is we need to get help first. So if I am by myself, I'll put them into the recovery position, I'll get on my phone, go get help, and I need to get on that phone. 999 112, ring an ambulance. If someone else is there that can get help, you get straight on that chest and start CPR, they can go and get the help for you. And always, always remember to ask for an AED as well. So, CPR for an adult. Someone's gone to get me help, they're on the phone, I start my CPR. With an adult, we start with compressions first. The only time that is different is if I've suspected this adult is drowned in, say, a lake or something behind me, I will start with 5 initial rescue breaths. In this case, it's just a normal adult, collapsed, not sure why, we're going to get straight on that chest. So, we can do CPR over clothing to get it done quicker, but sometimes it is easier just to get a little bit of that chest so we can see where we're aiming for. And where you want to be aiming is dead center of the chest. Easiest way to do that is from their armpits, draw an imaginary line, and you go to the center of that in their chest. 2 hands for the adult CPR. Best way to do that, 1 hand on top of the other hand, hold one of your hands, put the heel of your hand on that dead center spot, lean right over with your arms nice and straight, and then when I'm pushing on that person's chest, the only pressure on their chest is going to be that heel of the hand. That's the most effective CPR. So dead center of the chest, I'm going to be aiming for 30 compressions. I want to be pushing up to 1/3 of the depth of their body and going at a rate of 100 to 120 beats per minute. So I'm going to give you a demonstration of that now. Hands like so, dead center of that chest, lean right over, 30 compressions. Now with adult compressions, you may sometimes hear a little crunching sound or cracking sound. Do not let that put you off. Sometimes you may break a rib or two. Don't worry about that. Now, ideal scenario, if you're a first aid trained person, or you have protection so we can give rescue breaths, you want to be giving that person these rescue breaths. It gives them the best chance of surviving, giving them that oxygen. So after I've done my 30 compressions, I want to be giving them 2 rescue breaths. Now, if I didn't know the person, there was sick, there was blood, I had no means to protect myself, I could just continually do chest compressions until that help came, or I was too exhausted to carry on, or again, if they come around. So I'm going to demonstrate now how we would do 2 rescue breaths. You want a face shield if you've got one, or a pocket mask, any means to protect yourself. We open it up, look at the little picture, and just put it on their face as the picture shows you. And what I want to be doing is that chin lift, head tilt again, get that airway open. Once that airway's open, pinch the nose, give 2 good breaths, okay? You should hopefully be able to see a little bit of chest rising, and after each breath, get a nice fresh breath, as I'll show you now. Fresh breath. Fresh breath. Now, once I've done 2 of them, I'm straight back on that chest. You don't really want to be wasting any time. I get straight back on there, good arm position, and I'm back onto my 30 compressions. And once I've done 30 of them, I'm then back on to 2 rescue breaths. And that cycle will continue. 30 compressions to 2 breaths. 30 compressions to 2 breaths. And now we will ideally do that until the ambulance comes and helps. If you're physically exhausted, cannot carry on, or it gets dangerous, or again, if they show signs of life. Ideally, a defibrillator is what we want. So when the defibrillator gets there, we need to get that on their chest. So just to recap, adult resuscitation. Check for danger and catastrophic bleeding. Check for that response. Get that airway open. Check for that normal breathing. No signs of normal breathing. Get on the phone for an ambulance. Get help. You need that help there. Ask for that AED. Then you need to be 30 compressions to 2 rescue breaths. Continue that until that help comes. They wake up, or you're too exhausted to carry on. My name's Dan Hamilton from White Horse Training. Thank you very much for watching our video.